Exercise 13 is an important one because this begins the material that you are going to need to really master in order to do your unknown in just a few weeks from now. All right, so really important to not only understand the tests that you're doing, but also to be looking around at people around you and see how their organisms look different than yours. All right, and I'll try to highlight places where that becomes really critically important. Okay, so Staphylococcus identification. Let's look at Staphylococcus as a group, as a genus to begin with, and then we're going to look at three of the most popular staphs, the one that's basically you read about in all the literature. Okay, but there's more than 40 or so. That number tends to change, between 30 and 40 different species of Staphylococcus. Okay, we have used one of the staphs in almost every lab, so you should be pretty familiar with their characteristics. In general, whoops, let's not do yellow. They are gram-positive round cells, right? Cocci. Typically, they're going to be arranged in clusters. Okay, they are facultative. So not too particular about their metabolic requirements. They can generate energy by respiratory or fermentative pathways in general. They are a little bit more tolerant to salt. If you remember, we saw that back in Lab 7 when we were testing osmotic pressure. The two staphs that we tested tended to survive in a little bit higher concentration of salt. Okay, they're not halophiles, but they are, maybe you would consider them facultative halophile, or anyway, a little more salt tolerant. And that makes sense. These are organisms that are typically going to colonize our skin. Our skin can be kind of a salty place when we sweat, so that makes sense that they can tolerate that. Okay, so you're going to find staph ubiquitous everywhere on our skin. I would say the upper respiratory tract as well. Also, really in nature, they're everywhere. Soil dust, air, water, food and dairy products. So you're going to find staph just about anywhere, everywhere. Okay. So let's look at some staphs. It's kind of the clinical importance of a few of our Staphylococcus. Of course, Staph epidermidis, that's the one that you should be really familiar with. That's part of our normal microbiota on our skin, like I just mentioned. Probably outcompetes other organisms that might be more likely to cause an infection or to cause a disease. Okay, so doesn't harm us at all, probably helps us. If that Staph epidermidis gets somewhere that doesn't belong, then yeah, it can cause some more serious infections like the heart valve infections, endocarditis, but that's very rare and typically only if there's maybe some kind of surgery or, wound. Okay. Staph saprophyticus, I don't think that we have worked with that one yet. That is part of the normal microbiota vaginally. Okay, so also not of high clinical significance, this organism, but it is a common cause of urinary tract infections for females. Okay, and that's pretty much it, not much beyond that. The real nasty one in this group of staph that we'll be working with is Staph aureus. And again, remember, this is a strain that's supposed to be benign. It's not supposed to cause any of the things that I'm going to talk about right now. Okay, aureus is Greek for gold. So commonly the colonies are maybe have a goldish, yellowish tinge. The strain that we work with, it's more of a kind of a creamy color. We try not to make that obvious. So for your unknown, you don't look at it and say, oh, I don't need to do anything. I know I have Staph aureus. Okay. Let's see, what else? Staph aureus, this causes a whole lot of stuff. Skin infections. Okay, mild ones, all the way up to potentially very dangerous. So you're going to see things here like, I believe this is a furuncle, kind of a skin infection it's a little bit nastier that our immune system has a hard time of overcoming. This one has the potential definitely kind of to get bigger and go more systemic and maybe form a carbuncle. Up here, this is a picture of impetigo. It's a common childhood illness, mostly on the face of kids. This is an infection due to one of the virulence factors that I'm going to talk about a little bit later. It doesn't takes a really long time for that to clear up, for our body's immune system to clear that infection. Generally need some antibiotics to help with that so that the patient doesn't get scarred from those lesions that tend to kind of crust over and then just break open again. Okay, another infection that typically presents as a skin infection is MRSA. So MRSA stands for methicillin-resistant Staph aureus. Okay, so that's a strain of Staph aureus that's resistant to a whole class, many different classes of antibiotics, not just methicillin, which is a beta-lactam, but lots of other antibiotics. So again, often presents as a skin infection, difficult to get rid of because we have so few treatment options. Okay, let's see, what other kinds of infections? Also things like food poisoning. Okay, some strains of Staph aureus produce a particular kind of toxin that can make us throw up or give us diarrhea. And due to that toxin production, if you, say, have eaten some potato salad at a picnic that was contaminated with Staph aureus and it grew up there for long enough and had enough chance to produce the toxin, pretty quickly after you ate it, like within half an hour, you would start feeling ill. So it's a little bit easier to pin down what the offending food was when it happens so quickly. A lot of food poisonings, it may take days or even a week until a person starts getting ill because that organism has to grow up inside of them. Okay, so Staph aureus food poisoning typically is not too severe, maybe lasts for a day or so, but again, it does hit you right away because of that toxin production. Okay, and even more serious infection caused by Staph aureus is toxic shock syndrome. Okay, again, due to toxin production by some strains of Staph aureus, this is a potentially fatal infection. We had a huge, really this came onto the scene in about 1980. At that time, a tampon came on the market that was marketed to be so absorbent that women could leave them in for 8 to 10 hours and they wouldn't leak. And they did their job, but unfortunately that made an ideal medium, that bloody tampon, nice warm place that blood changes the pH in the vagina, and that was an excellent breeding ground for this strain of Staph aureus that caused this toxin production that caused patients to go into shock. Okay, their blood pressure came down so low that basically all their organs started to shut down. Okay, so those tampons were pulled from the market. Shouldn't leave tampons in more than 4 to 5 hours. Incidence is very low today. Men can get this as well, and it's not well understand why that is, but high fevers, rash, having to do with that toxic shock syndrome. All right, so that's a little bit about our three organisms. Let's talk briefly about different kinds of media in general before I talk about what you're going to be inoculating. Okay, you may have talked about this in lecture a long time ago. I want to highlight the difference between media that's considered differential and media that's considered selective. We've worked with a lot of differential media, or some examples of differential media so far. This is media that changes its appearance due to some characteristic of the organism. Okay, so everything grows, but certain organisms will have a different appearance than others when you grow it on this medium. So, for example, the fermentation tubes. Okay, those had lactose, say, or some sugar, say lactose in there, and a pH indicator. And if the organism could use the lactose, we would get a yellow color change. So after the organism had grown in that tube, if we got a color change, that would tell us something about the organism. It would help us understand a characteristic of that organism, and we could compare it to something else. Okay, another example would be the phenylalanine deaminase tubes. All right, we inoculated it, add the reagent, read the results. If we got a green color change, and we know that that organism makes phenylalanine deaminase. Okay, some medias, so lots of medias are differential, some are not. So something like nutrient agar. It's true that some colonies will have a different appearance than others, but it's not due to any like biochemical characteristic that we can pin down. Okay, so not nutrient agar, not Mueller-Hinton agar. Okay, those are not differential. Today, you're going to work with your first selective media. Okay, selective media has been enriched with ingredients so in order to, we'll say, encourages the growth of certain organisms while inhibiting, underline, the growth of others. Okay, so selective media, if you streak out a mixed culture, probably, maybe only one of those organisms is going to grow, or maybe only the gram-positives, or only the gram-negatives, or only organisms that are resistant to whatever antibiotic you put in there. Okay, so with differential media, everything grows, but certain things look different. With selective media, only certain things grow. And certainly media can be both differential and selective. They can be neither one as well. Okay, so the selective media that we're going to inoculate today, I'll make an arrow here, we abbreviated CNA BOP. Okay, and that stands for colistin and nalidixic acid blood agar plate. Okay, and when you see these in lab, you are going to understand right away, yes, there is blood in this agar. It has sheep's blood in it. Okay, so that's a really rich medium. Lots of organisms grow really fast, really well on blood agar plates. But the selective agent in there are these two antibiotics, colistin and nalidixic acid. And these are antibiotics that select against gram negatives. Okay, So only gram-positives grow. Okay, in case you're interested, colistin is a polymyxin antibiotic, so that works on the outer membranes, especially against gram-negatives. Nalidixic acid is an inhibitor of DNA gyrase, so it blocks DNA replication. For some reason, that works best on gram-negatives. Okay, X. Okay, so colistin X, kind of like a detergent against gram-negatives, and nalidixic acid targets that DNA gyrase, which is slightly different, apparently, in gram-negatives. Okay, so everybody is going to take a mixed broth. So that mix has E. coli in it, a gram-negative, and one of our staphs, I believe it's Staph aureus, in it. And you are going to streak that out. 4-quadrant technique, remember to flame your loop in between the quadrants there. Okay, flame your loop. Okay, again, this is our CNA Blood Agar. Okay, and then after we incubate this, it should look like a pure culture. Okay, so you're going to check that real carefully. Hopefully you will only see one kind of growth. That's the Staph aureus, because again, the gram-negatives should not survive due to that colistin and nalidixic acid. Okay, we will also have a selective media that works only gram-negatives can grow on. Okay, so it's important to have a selective media to when we're doing our unknowns, to make sure that we're working with only a gram-positive or only a gram-negative. Okay, in the next video, we'll talk about what else you're going to inoculate for this lab.